right, so I think we've approached the 12:30 mark, so let's just kick it off and people can join whenever they can. So for everybody that is with us right now, thank you for joining us. This is our next part in our We Create Change online speaker series. We are still continuing to recognize June as National Healthy Homes Month. And just in case you're new here, my name is Hannah, and I am the Healthy Homes Coordinator at Women for a Healthy Environment. And thank you again for joining us. So today we are super excited to have Sarah Goodwin here with us today. She's a policy analyst at the National Center for Healthy Housing, NCHH for short. NCHH is a national nonprofit whose mission is to secure healthy homes for all. And NCHH has been a crucial advisor and partner in coordinating our local-led advocacy work. And they are the national experts in this space. And we're super fortunate to have you guys here today. So for those joining, if you have any questions, just put them in the comment section and we will get to them at the end. So I will kick it off to you, Sarah.
Great. Yeah, so my name is Sarah Goodwin. Thanks so much for having me on today. I'm going to be talking about healthy homes policy and advocacy. As Hannah said, I'm a policy analyst at the National Center for Healthy Housing, and the additional piece that I do there is that I coordinate the National Safe and Healthy Housing Coalition, which is a national coalition of people at the federal, state, and local level that has a big focus on healthy homes advocacy. So that's kind of another piece of what I do and why I'm here. So today we're going to be talking about a few things. I'm going to do a little bit of an introduction to federal healthy policy and kind of what we mean when we talk about that and the key programs. And then I'll go through the appropriations process and how money actually gets to these programs. And then I'll do a little bit about like how you can take action on federal policy from where you are locally, and then we'll do the questions at the end. So when we say healthy housing programs, we're typically talking about kind of three big agencies that have the most work focused on healthy housing programs, but there are relevant programs to healthy homes kind of scattered throughout the federal government at a bunch of other different agencies. So the three that I'm going to talk about in just a minute are the Department of Housing and Urban Development, the Centers for Disease Control and Prevention, and the Environmental Protection Agency. So again, the healthy homes is like a big umbrella, and there's a whole bunch of programs that are relevant to it, but the three agencies that we're most focused on are these three. So for each of these agencies, I'm going to kind of go through what the key programs are that we watch. So on each of these slides, I've got all the programs that we track funding for. So every year we kind of watch what the funding amounts are for these programs. And then the ones that are outlined in green are the ones that the National Safe and Healthy Housing Coalition publishes annual funding requests for in the form of sign-on letters that we then submit to key members of Congress. So for each of these agencies, I'll kind of focus on those, programs in green with these, noting these additional ones that are also really important. So at HUD, that's the Office of Lead Hazard Control and Healthy Homes. And this is the program that supports state and local programs through grant dollars to reduce lead hazards from homes. And then also has, there's also regulations that have to do with this office. So if you have a program in your area that is able to do, removing lead hazards from homes and they have federal funding, it's often, not always, but often they're getting funding from this program. And these are, this is what the current funding amounts are for these programs. And the Office of Lead Hazard Control and Healthy Homes is currently funded at $290 million. And the National Safe and Healthy Housing Coalition's request for funding for next year was to increase that to $606 million. At CDC, the programs that we focus on here are programs that live within the National Center for Environmental Health. And the three programs that we're focused on here are all programs that support funding to mostly states, sometimes localities, but they're typically funding to states. And the focus is generally on surveillance and data collection. There's other activities that they do as well, of course, but the big focus here is on collecting really good data about healthy homes issues. So the three kind of key topic areas here are childhood lead poisoning prevention, asthma, and then environmental public health tracking. And again, they kind of each do that a little differently, but with the overall focus on surveillance. These are the current funding amounts for these programs. The lead program is currently funded at $37 million, with the coalition submitted a request to increase that to $100 million. And the National Asthma Control Program is currently funded at $30 million. The request was to increase it to 34. And then the Environmental Public Health Tracking Network is currently funded at $34 million, with the coalition requested increase to 40. Over at EPA, we have a whole bunch of programs that have to do with healthy housing. Some of these boxes, you can see I've kind of combined a couple programs together in talking with them, because EPA gets a little bit, granular with their line items sometimes. It can be a little confusing, but they're generally grouped into kind of these 4 topic areas here of lead, radon, indoor air quality, and then a focus on children and other sensitive populations. And activities that programs at EPA often do. Sometimes it's grants to states like the other programs we've been talking about, but it also includes regulation, things like lead safe work practices and requirements, and sometimes it's things like a national radon action plan and kind of trying to set policy or recommend policy across the federal level. These are the current funding amounts for these topic areas. Again, some of these are a little combined. The coalition has requested increases of between like $2 and $5 million for kind of each of these programs. I wasn't going to go through all of them because again, it's a lot of numbers, but this is generally where their current funding levels are at. As I mentioned at the beginning, there are a ton of other programs that we watch at other agencies across the federal government, including Health and Human Services, Department of Agriculture, Department of Energy. These are kind of some of the topic areas that we watch that are relevant to healthy homes, even if they're not, don't have healthy homes in the name or aren't super directed at healthy homes. Things like health and nutrition for young children, affordable rural housing, pre and postnatal care and home visits, weatherization, energy assistance and energy efficiency, veterans housing, and other things like that. I did want to take one kind of brief step back before moving into the details of how funding works, just to kind of briefly address this question of why we advocate for these specific programs. So it kind of speaks to how federal advocacy works in a way. The position of NCHH is that addressing healthy homes issues is work that has implications and for programs like across the federal government. It's not just programs that have healthy homes in the name. Healthy homes is a really big topic that touches people in a lot of different ways, and there are a ton of different federal programs that are relevant to healthy homes and that can be doing work that improve the conditions of homes and make them safer and healthier. But our job as a healthy homes expert is to focus on the programs that are specific to healthy homes, because that's where we can kind of provide, that's where our strength is. But then it's also important for us to listen to and partner with others and other partners who can offer guidance on programs that address those topics that are related but not directly healthy homes. So things that are more like general children's environmental health or affordable housing that includes, a lot of other things besides just healthy homes. So again, that's kind of federal advocacy is best and is strongest when you are connected to others who are doing, overlapping work or similar work where you can you take the lead on the programs that you are the experts on and that are most relevant to you, and then listening to and partnering with others who can be the experts on things that are also important but aren't quite within your piece. So how does funding get to these programs that I've just talked about? So I'm going to kind of go over what the typical kind of timeline looks like for it, because it impacts how we do advocacy. The federal fiscal year ends at the end of September. So on October 1st, there needs to be funding in place for programs. Otherwise, the government will shut down or partially shut down, which we've seen happen several times. So the typical timeline kind of looks like this. Subcommittees are taking requests in the spring, and that means both requests from us, the advocates, and from other members of Congress. So, other representatives, even if you're not on the appropriate subcommittee, will, submit letters or talk to their colleagues about why they think they should fund particular programs that's really important to them. But they also look to us who are advocates and who are experts outside of Congress to submit requests to, what we think should be a priority in the next round of funding bills. And that's where I was talking about earlier, the request that the coalition has put together. This is kind of where it goes, is in this early process, saying this is what we think you should be funding. Typically, subcommittees and committees try and, pass through their bills in June and July. And then again, in an ideal world or on paper, you might see the appropriations bills, get passed off the floor in the summer so that they're ready, and signed into law by the end of September. That has not happened in a long time. So typically what we've seen is like a continuing resolution that they, in the fall, then they put all the bills together into like a big omnibus or a couple of different packages in like late fall or in the winter, sometimes even early spring. And that way they can just vote on one at a time. Again, this is kind of just how it's happened over the past several years due to a lot of different factors about how Congress works. The important caveat here is that this year is kind of weird because of the COVID-19 pandemic. That Congress has been, they've had to do supplementary funding and been focused on a lot of other issues. So the timeline is off this year. So we're not really sure exactly what we'll see in terms of, when an omnibus bill might come together or what that might look like. Also complicated by the fact that there's an election in the fall that takes a lot of, members' time away from being in session to be campaigning before November. So again, this is what it's typically looked like the past few years. And the key moments for us as advocates are early when they're taking requests, and then just watching what's happening with omnibuses. And then there's sometimes opportunities to, when they're putting an omnibus together, to contribute and say, we made our request early when you were first writing the bill, but we really want to make sure it's in this omnibus when everything gets put together. The important subcommittees to keep in mind if you're concerned about these particular programs that I mentioned before. The HUD funding gets bundled together with transportation and the Transportation, Housing, and Urban Development subcommittee. CDC's funding comes through the Department of Health and Human Services, and HHS is bundled together with labor and education, so that's the important subcommittee there. And then EPA's funding goes with the Department of the Interior in the Interior Environment Bill. I'm not going to go into a whole lot of details about funding history, because that's not the focus here, but I did want to highlight a couple of recent funding victories as evidence for why, putting advocacy is important, and you can sometimes see results. We've seen some great results over the past couple of years, particularly in federal funding for lead. So this is the history of HUD funding over the past few years for the Office of Lead Hazard Control and Healthy Homes, and you can see that it's basically doubled since 2017. And we've seen a lot of new resources going to that office, which means more resources then going to states and cities on the ground to remove lead hazards. Over at CDC, the funding for their lead program was nearly eliminated in 2012 and has now in 2020 come back up to what it was at before it was eliminated. So we've been able to see that program kind of bounce back up and, begin serving communities again and, make the capacity even stronger. So that's kind of how, what the programs are and how the funding works. Here are some ways that you can move toward taking action on federal policy, even if you are not a person working in DC on federal policy all the time. First of all, if you want to join the National Safe and Healthy Housing Coalition, you can get connected to the advocacy work that I've been talking about with the requests that the coalition submits every year. If you join your base, you get on our email list, and so you'll be notified about opportunities to join sign-on letters every year, again, typically in the spring, but sometimes throughout the year as well as getting connected to just webinars and resources and other things that the coalition shares throughout the year about healthy housing in general. If you're interested in finding more about healthy homes issues in your state, the second link here is links to our page on NCHH's website where we have a series of state fact sheets. We have all 50 states, DC, and then the 5 major territories. And these are updated annually, and they include both statistics about healthy homes issues in the state, what information we could find about what the biggest issues in the state are, and then also it lists the federal programs that are funding programs in the state. So where is your state getting money from, and why are these programs that important to where you live? Number 3, I wrote down here just to connect with others in your community. As I mentioned before, advocacy can be strongest when you're partnering with other people, and especially if you want to advocate for programs that are doing work in your community, it is always a good idea to figure out who else is interested in this kind of thing, and then build a strong united voice around that. And then finally, you can meet with your member of Congress, and I'm going to spend a little more time on this particular piece because it's something that I think sometimes people know they can do conceptually, but you may not know exactly how to get started or what that really looks like. And this is something that anybody can do, from wherever you live to try and meet with your member of Congress and talk about healthy homes issues. So why should you do that? Well, first of all members of Congress have offices both in DC and in their home districts. So you don't have to travel to DC to do this. The coalition sometimes will have like Hill days where we bring advocates to come to the Hill and do these meetings, which can be really exciting and really powerful. But you don't have to do it in DC. You can do it from where you live. If they have a large geographic area that they represent, they will often have a few different offices to try and get at different population centers. Logistically, they can be a short time commitment. Meetings are often 15 to 30 minutes, so you may not have to commit a whole bunch of your time if you don't have it. And why it's important kind of speaks to what these meetings are like. So the meetings are usually with staff. When we say meet with your member of Congress, it's not usually the member themselves. Sometimes they will drop in. Their schedules can be busy, but kind of depending on the time of year, you might actually get some FaceTime with the member. But even if you don't, it sounds like anticlimactic sometimes, but meeting with the staff is actually really important. The reason being that staffers in congressional offices oversee a ton of topics. They may have a portfolio that includes housing, but it also includes like education or a whole bunch of other issues. So they can't be an expert on everything. And so they look to outside experts and outside advocates to educate them on why this is an important issue in their district and what they should be doing about it. So they're looking to learn from you. And if you build a strong relationship with a staffer or with an office, they may start to look to you, when they come back to you, when they have more questions or when something comes up. So there are offices that we at NCHH, have reached out to for many years and have talked to several times. And so then they may start to see us as a resource that they know if they have a question about one of these topics, they can come to us and they'll, get a good answer and will be really helpful. And so if you can build that kind of strong relationship, that can endure beyond just the one meeting. And that's why, it can be really important to do these kinds of meetings. The final note here, sometimes people are concerned that if you have a lobbying restriction, like if you work for a certain organization, that you may hear that you can't lobby. And which is sometimes true, but speaking to offices does not constitute lobbying if you don't discuss a specific legislation. So you can talk as long as you want about why healthy housing is an important issue, how it affects your state, even saying, this program is really helpful for us because here's why. As long as you don't ask for anything, it's not lobbying, it's just education, which anybody can do. So if you don't feel comfortable making an ask, you don't have to. You can still have a really productive meeting educating them about the issue without saying, here's what I want you to do. This is what a typical meeting structure looks like. A few key points here are, we often recommend you do like a thank you at the beginning. If your member of Congress has already done something important for healthy homes, or they've sponsored a bill, or that they signed a letter or something, you can mention that so that they know you're paying attention to what they're doing. And we'll hopefully incentivize them to kind of do more of that stuff in the future, and kind of build that relationship again. And the key point here is telling your story. So again, even if you don't want to have an ask, which is listed here on a typical structure, but you don't have to do that if you don't want to. Again, the key point is telling your story. So I'm going to kind of go through what telling your story looks like in a few different situations. So when I say tell your story, it sometimes sounds like I mean just like a personal story, but that doesn't have to be true. If you have a personal experience with a healthy housing issue that you want to share with them, you can definitely do that, and they'd love to hear that from you. But if you don't, or you're speaking more of like from a workforce perspective, or you're just speaking as a general advocate, that's also really valuable. The key point is to start with saying how health hazards in the home have affected you, whether that be your family, your community, your state, or another measure. And this might be like this might be like a kind of a general statistic or something, just kind of stating, making them aware of what the really big need is in Pennsylvania or wherever you are. The second piece then is to move from talking about the issue to talking about the programs that address it. So again, if you have a particular experience with a program, you can talk about why that helped you, or maybe if you work for one of these programs, you can talk about what you do, or maybe you volunteer for a program that's really important. You can talk about how it's been impactful. Or maybe it's just a general program that's operating in your community that has managed to serve a certain number of families and has been really helpful for them. Even honestly, if you don't have those programs in your specific community, you can still talk here about why there is work that can fix healthy homes hazards. So you've introduced in the first step kind of the issue of, healthy housing is a big big topic that impacts people, pretty severely in a lot of ways. But then step 2 is we can fix that. There's a lot of efforts and really great programs people are doing that will address these problems. And here's how we, make homes healthier and safer. And then part 3, just to tie those together, is to saying, this is why continued funding or continued support for these programs is important. Again, even if you don't have a specific funding ask you're coming with, you can still kind of end on this point that, support for these programs needs to continue. And, because there's a really big need, the programs work, and, we should continue supporting them because it will have, there's a lot of other families that need help, or there's a lot of other, work that still remains to be done. A few notes about preparing for meetings. If you are interested in having a meeting, one of the things we're happy to do as a national organization is help you schedule those meetings. It can sometimes be unclear how to kind of get in contact with the office at first, and we have done that a lot, and we're happy to kind of be the go-between between you in the district and the staffer that you'd be meeting with. In this age where lots of things are happening remotely right now, and I'm sure we could probably try and set up like remote meetings with with offices as well if you don't want to go in person, or if their offices are currently closed. Other kind of points I recommend for preparing for meetings are just to review talking points ahead of time. If you practice telling your story so that you kind of get rolled out smoothly and you can get across all the points you want to make. I've listed here some resources that I would give to anybody wanting to make a meeting about healthy housing. The first being the state fact sheets that I mentioned before. The second are agency fact sheets, which we've also published here at NCHH, and they kind of do what I did in the first few minutes of this presentation, just talking about all of the programs that are relevant to healthy homes and that address healthy homes at the federal level and how much money they get. So you don't have to go in having any of that memorized or even being an expert on any of those. You can take the fact sheets that kind of say, here's what these programs do and what impact they've had. And then finally, we're always happy to support however we can any of this engagement that you're doing. So whether that's scheduling a meeting, or if you want us to get on the phone with you and like review information or do a practice session or anything like that, we're happy to kind of be a resource as people who've done this a lot. If you're someone who hasn't done this as much and kind of needs some help putting it together. So in closing, this was like a super surface level summary of some of what federal policy and advocacy looks like. And I really only focused on appropriations and funding, but I've listed some resources here. I would also be happy to share them offline or post them, or however that is helpful, of other places you can look if you're interested in learning more about how policy works in healthy homes, either at the federal, state, or local level. So these are just examples of places you can go if you want to learn more about what these policies actually do, or see recommendations for how we can, make them better to address further future healthy homes issues. So that's all I have for my talking. But if there are any questions in the chat, I'd be happy to answer them.
Yeah, for sure. Thank you so much, Sarah. That was really, really great. It's really helpful to understand the process and how, people's input can be influential in where money goes and how it's allocated. There was one question, how does NCHH prioritize equity in their funding decisions and policy recommendations? So that's maybe something that we could emulate on a local level too.
Yeah, that's a really good question. It's kind of a broad question.
Super broad.
Yeah, I think a few different answers. So there's kind of, I guess, two parts, two answers to that question, I guess, which is one that I only talked about the funding asks here, but another thing that NCHH does is to try and watch what the programs are actually doing so that we can make recommendations or support recommendations from others about how they could do better work, because lots of programs can always be improved, or there's policies that maybe need to exist that don't currently exist. And so some of that includes looking at at federal work from an equity lens and seeing, are they actually serving people equitably? Are there issues that need to be addressed? So that's kind of part of that. I guess it's kind of a vague answer, but this was a super, just kind of top level what the appropriations numbers look like. And when we start talking about, actually what the policy recommendations are, that's often a pretty important lens to make sure that they're actually working, especially with healthy homes, because as we know, so many healthy homes issues are, tied to, and, to systematic racism in housing or in other historic policies. And it's important that policies trying to address those issues are equitable and are actually meeting the need where it is.
Thanks. And then I actually had one for you. And I probably know most of the answer to this one, but it's a fun one. So, lead is often a primary focus of most healthy housing policies, just because it is so prevalent, especially in communities with old and aging infrastructure. But Western Pennsylvania is not unique in the fact that we do have elevated levels of radon in our basements, and we do have flooding issues that cause mold issues. And so how do you, or does NCHH recommend, including that those policies and those health concerns are prioritized just as much as we talk about lead?
Yeah, that's a great question. There's a few ways. So one thing is just to remember when you're messaging around these topics that it's not just lead. Part of the reason we made the state healthy housing fact sheets is because that includes a whole bunch of those topics. So it's not just lead in your state, but it's radon in your state or carbon monoxide poisoning in your state and others like that. So we try and kind of present that holistic picture on resources and other resources like that. And the other thing is that there are, we've kind of expanded some in the past beyond just advocating funding for the lead programs that I mentioned here, where we've seen that big success, but also the coalition publishes funding requests for the programs that are more specific to other healthy homes issues. So at CDC, that's the asthma program and the Environmental Public Health Tracking Network. And within the HUD Office of Lead Hazard Control and Healthy Homes, not all of that funding is just for lead. There's also the Healthy Home supplemental funding that goes to communities. That is really important, and where we would like to see more funding for that program so that there's flexibility to address those other issues as well as just lead.
Thanks. And I'm just going to check over here, make sure I didn't miss any. Okay, we have another one. Is there any sense that the last 2 years of HUD funding will be replicated in the next federal fiscal calendar, or will this require a heavy advocacy focus?
I'm trying to think about the best way to answer this. I think we've seen some really great positive results with the HUD funding, especially focused around lead. I don't think we're getting a sense that funding is in danger of kind of dropping back down, especially there's a tendency, especially in years like this one, where Congress has a bunch of other competing priorities, to kind of stick to level funding. So we're really happy that if, at least for the HUD-led programs, maybe not for the others, but for that particular program, if this year Congress just funds everything at the same level it was before, that program still has a bunch of, it's now at that higher level, and so they'll be able to get a lot of resources. So in that sense, that's the optimism there, in that we're not seeing, at least I haven't heard, big threats to cut it back down or anything like that. And if they're funding at level amounts, then it'll remain as it is now.
Okay, great. I think that was all the questions, but if I missed any, I'll shoot them over to you and we can answer them in the comments. But we approached the 1 o'clock time mark too, so we tied it all in a half hour, and that was a lot of info to cover. So thank you. And if I do see any more comments, we'll make sure we get them answered. But thank you again, Sarah, for joining us. You provided some really great information for us to take back to our communities. So yeah, if you have any other last words to leave us with, we can end there.
Yeah, again, thanks so much for having me. This was like a ton of information in a short amount of time. And again, like the super high level of what federal policy advocacy entails, but I'm happy to, engage in the comments with anybody else, or if folks want to email me directly or anything, happy to continue the conversation there.
Awesome. Well, thank you so much. I will click end on my screen. And thank you again for joining us. And thank you to everybody who joined us through Facebook too. And this will be saved, so feel free to circulate it. All right?
Great. Thanks so much.
Thank you so much.
Yep.
Bye-bye.
Bye.